Good afternoon. Our first item is questions on health and wellbeing. Question number 1, Richard Lyle.
Thank you, Presiding Officer, and it's very nice to see you back. To ask the Scottish Government what discussions it's had with the NHS Lanarkshire regarding the Board's future plans.
Can we just stop everybody saying how nice it is to see me back? I'm delighted to be here, but yesterday everybody said it's nice to see you back, so we'll just take it as read. Cabinet Secretary.
Moving straight to my answer. Ministers and Scottish Government officials regularly discuss a wide range of matters of local importance, including future plans with all NHS boards.
Richard Lyle.
Can I thank the Minister for that answer? Does the Minister share my concern that the Labour Party in Lanarkshire appear to be campaigning to close the mental health unit in Monklands Hospital, which serves people from across the region, including Cumbernauld, Kilsyth, Airdrie, Belsalon District, Kirkintilloch and beyond? Does the Minister agree with me that this campaign should be opposed and the unit should stay open?
Minister.
Presiding Officer, I appreciate the strong local feeling in support of the inpatient mental health unit at Monklands Hospital. However, at this stage, we have not received a proposal from NHS Lanarkshire for a major service change in our mental health services. Should such a proposal be submitted to Ministers, it will of course be given very careful consideration.
Richard Simpson.
Yes, can I ask the Minister, in working with Lanarkshire on future plans, whether he can encourage the Cabinet Secretary to actually fulfil his promise made to me some 2 months ago, to write to me with an explanation of the astonishing reduction in social unavailability achieved by Lanarkshire Health Board from 27% to 7% between the summer of 2011 and 2012, a promise which he gave in this chamber but has yet been unable to fulfil.
Minister.
I've got absolutely no doubt the Cabinet Secretary will want to ensure you get that reply within the next week.
Question number 2, Graham Pearson.
Thank you, Presiding Officer. To ask the Scottish Government what its position is on the fairness and transparency of the individual patient treatment request system.
Cabinet Secretary.
The Presiding Officer, NHS boards are expected to take full account of Scottish Government guidance when dealing with individual patient treatment requests for medicines which have not been accepted for routine use within the NHS in Scotland. The guidance provides NHS boards with a framework to support consideration of IPTRs in order to achieve consistency of approach. It makes clear that, as a matter of good practice, NHS boards should ensure that IPTR decisions are communicated to the patient representatives responsible for their care. The guidance also clarifies that this discussion should be accompanied by a letter from the chair of the IPTR panel to provide a summary of the rationale for the decision and to set out the circumstances under which an appeal can be considered. Where a patient has any concerns about fairness or transparency in relation to their IPTR, this should be discussed with the requesting clinician. The Scottish Government guidance includes a section to describe the circumstances under which an IPTR appeal can be considered. The recently announced New Medicines Review includes a strand of work to examine the current IPTR arrangements and to advise on whether any changes are needed to it.
Graham Pearson.
I'm grateful to the Cabinet Secretary for that response. The guidance that he refers to is dated the 17th of May 2010, and indeed the key features of the guidance is quite clear in the direction it travels. He won't be surprised at the recent discussion at the Health and Wellbeing Committee. There was concerns about the application of those guidance, and my own personal involvement in cases looking at the system indicates the guidance had not adhered to. Will he take steps to ensure that it is?
Cabinet Secretary.
Presiding Officer, if the member wants to send me details of where the guidance has not been adhered to, I certainly will have that matter investigated and a timorous response sent to the member.
Question 3, Angus MacDonald.
Thank you, Presiding Officer. To ask the Scottish Government how NHS boards ensure that GPs reduce the unnecessary waste of prescribed drugs.
Cabinet Secretary.
Presiding Officer, the prescribing workstream of NHS Scotland's Efficiency and Productivity Programme is addressing medicines waste in a number of key areas. Scottish Government guidance, appropriate prescribing for patients and polypharmacy guidance for review of quality, safe and effective use of long-term medication, issued in November 2012, provides guidance and recommendations on how to manage patients taking multiple drugs. It promotes that by further optimising the therapeutic benefit of complex treatment, there will be a resultant reduction in medicines waste. This process includes stopping drugs that are of reducing benefit and increasing risk, particularly with the frail elderly. Repeat medicines are also being addressed by a project that promotes a more in-depth review of repeat medicine lists. Careful management of repeat medicine lists will reduce the potential for over-ordering medicines not required by the patient. All other areas of the prescribing, including 12 national therapeutic indicators, promote quality and cost-effective prescribing, a key aim of which is to reduce medicines wastage. The Scottish Government is also promoting compliance with NHS Board's local joint formularies as a key means of reducing the use of drugs considered less suitable for prescribing, as identified in the Audit Scotland report, Prescribing in General Practice, published last month.
Angus MacDonald.
I thank the Cabinet Secretary for his answer. He refers to the Audit Scotland report, and I was encouraged to read in the recent report on prescribing in general practice in Scotland of NHS Greater Glasgow and Clyde's Invest to Save initiative. What can the Cabinet Secretary do to ensure the initiative is rolled out to other NHS boards in Scotland?
Cabinet Secretary.
The Presiding Officer, we are taking forward the report from the Auditor General and made a number of recommendations both to improve the quality and cost effectiveness of prescribing, and we intend to take those proposals forward and implement them throughout the entire country. I think the total estimated savings were £26 million a year.
Moral, don't pause for breath. Nanette Milne.
Thank you, Presiding Officer. Given the demographic changes facing communities across Scotland and the projected increase in the number of people with multiple health pathologies, which will presumably result in a corresponding increase in the volume of prescribed drugs, what assessment has the Scottish Government made of the cost of this to the NHS should current levels of wastage continue into the future?
Cabinet Secretary.
As I said in my first answer, Presiding Officer, we are actually, under the Efficiency and Productivity Framework, constantly reviewing prescription practices and analysing where there is waste in the system. And already steps have been taken to reduce waste and save a substantial amount of money per year. We will now take forward the latest Auditor General's report, which is estimated, if fully implemented, could save another £26 million a year in wastage, prevention of wastage of overprescribing in Scotland, and we will do that.
Question number 4, Sandra White.
Thank you, Presiding Officer. To ask the Scottish Government when it last met NHS Greater Glasgow and Clyde and what issues were discussed.
Cabinet Secretary.
Presiding Officer, both ministers and government officials regularly meet with NHS boards, including NHS Greater Glasgow and Clyde, and a range of matters of importance to local people are discussed.
Sandra White.
Thank the Cabinet Secretary for that reply. Can I ask the Cabinet Secretary if he is aware of the alleged practice of Glasgow City Council of quotas being implemented with regards to placements within care homes, resulting in a delay in discharging patients from hospitals, and would the Cabinet Secretary raise this matter at his next meeting with Greater Glasgow and Clyde Health Board?
Cabinet Secretary.
Presiding Officer, I'm advised that Glasgow City Council doesn't operate a quota for care home placements, although they, like most local authorities, do operate a budget for all forms of care. That said, there are no patients delayed in hospital awaiting funding. In addition, the delayed discharge situation is considerably improved in Glasgow City in the last year. And therefore, I'm happy to raise the issue, but I want to make sure that that progress continues.
Bruce Smith.
Thank you, Presiding Officer. At his last meeting with NHS Greater Glasgow and Clyde, did the Cabinet Secretary ask for a full report on the problems affecting the assisted conception unit at Glasgow Royal Infirmary? I'm still being contacted by distressed women and couples who have simply and categorically been told that they were unaffected, but without the information yet in the public domain as to what has actually happened at the GRI. And can I further ask further to the parliamentary questions that you'll be aware I've asked this department on the issue of access to IVF treatment. Now that the Scottish Ministers, as I understand it, have the report of the working group looking to standardise, can he give the Chamber some update as to the Government's direction of travel?
Cabinet Secretary.
Presiding Officer, we've received the report within the last few days, and we will be publishing the report in full in due course, fairly soon in fact, and we will then hopefully consult on the recommendations in the report with a view to implementing the recommendations that enjoy a consensus, hopefully across this chamber, as well as in the medical community.
Jackson Carlow.
Thank you, Presiding Officer. I wonder if the Cabinet Secretary would share the concerns of my constituents who have contacted me regarding the operational practice at the New Victoria Hospital. Last Friday, I understand, 2 receptionists were on duty to cover multiple clinics involving several hundred people before 9 o'clock and were clearly overwhelmed. But much more disturbingly and of concern, 2 patients who were referred to the Victoria Hospital for diagnosis of potential cancer treatment, having waited 2.5 months, who were told by their consultant that if they lived on the north side of the river, they would have been seen expeditiously in a fraction of the time. Will the Cabinet Secretary investigate with Greater Glasgow and Health Board whether or not there is an issue here and whether or not this situation is something that needs to be addressed urgently?
Cabinet Secretary.
Presiding Officer, I'd be happy to take that up, and if Jackson Carlow could provide me with more details, ideally this afternoon, I will make sure that's urgently investigated and dealt with accordingly.
Question number 5, Sarah Boyack.
To ask the Scottish Government when it expects NHS Lothian to achieve NHS Scotland resource allocation parity.
Cabinet Secretary.
Presiding Officer, the NRAC formula has been phased in from 2009-10. The formula was introduced to ensure that NHS board funding was better aligned to local characteristics such as deprivation, population, age profile and rurality. It is right that this was phased in gradually to minimise disruption to board finances. It's been made clear that any adjustments made to the 14 territorial health boards' funding would be phased in over a number of years, as has been the practice under both the previous share and Arbuthnot formula under previous administrations, and that no board would receive a cut in funding. As a result of this phased process, we've ensured that no board has lost out financially and have levelled up funding to support this. As NHS Lothian is below its target share of resources, the board receives additional NRAC funding each year to support the movement towards target.
Sarah Boyack.
The formula has not kept pace with Lothian's expanding population and services have been stretched. Any additional NRAC funding received this year will immediately be eroded as the board pays back the Scottish Government's waiting times loan. And this year the board remains £50 million below the target allocation. And this fundamental under-resourcing is at the heart of NHS Lothian's problems. Can the Cabinet Secretary provide assurance that he will look at addressing the funding gap sooner rather than later to take into account the key issues that are arising from a rising population in Lothians?
Cabinet Secretary.
Presiding Officer, we are addressing this issue, and in fact the board is getting an additional £12.3 million uplift as a result of NRAC on an annual basis. On top of that, every board this year and this coming year and next year every territorial board is getting a rise in excess of inflation. So the combination of those and proper management of its resources should allow NHS Lothian to deliver as required.
Malcolm Chisholm.
I thank the Cabinet Secretary for what he said already, but can I just re-emphasise the point that the population of NHS Lothian is increasing faster than any other part of Scotland, so does he not accept that that is creating particular pressures on the NHS in Lothian, in addition to the inherited problems which the new Chief Executive is obviously trying to sort out, and I think he is making a very good attempt at doing that.
Cabinet Secretary.
Thank you for that final comment from Malcolm Chisholm. I'll pass on his congratulations to Tim Davison. Can I say and remind him, first of all, that the NRAC formula is not just about population growth, but about the other factors that I mentioned in the first reply under this question. But secondly, one of the major problems in Lothian has been the undercapacity in the Edinburgh Royal Infirmary, because when that was planned many, many years ago, before this government came to office, there was a 20% underestimate of the population growth in the Edinburgh area. Obviously, that's an issue that we are tackling with the additional resources and additional capacity we've now put in place. I'm very aware of the challenges facing NHS Lothian, but very substantial progress has been made under Tim Davison's leadership in the last few months in tackling the backlog of problems that he inherited.
Question number 6, Bob Doris.
Presiding Officer, apologies for my late arrival in the Chamber. To ask the Scottish Government how best practice in prescribing is shared between NHS boards.
Secretary.
Presiding Officer, since 2011, the prescribing workstream of NHS Scotland's Efficiency and Productivity Programme has been working with all NHS boards to promote best practice and improve quality and cost-effective prescribing through national guidance, support tools and compliance with 12 national therapeutic indicators. In addition, the National Prescribing Workstream is supporting NHS boards in making better use of their Prescribing Advisors Network, which meets regularly to share information and good practice and to inform the Scottish Government about prescribing issues at a local level that may require national action.
Bob Doris.
Thank the Cabinet Secretary for that response. I suspect mention has been made of the 11% real terms fall in the cost of prescription drugs in the NHS since 2004, despite a one-third increase in drugs being prescribed. The best practice the Cabinet Secretary speaks of comes from NHS Greater Glasgow and Clyde. Can the Cabinet Secretary give a commitment that best practice in terms of prescribing advisors and the use of generic drugs, for example, for statins, will be shared right across Scotland?
Cabinet Secretary.
The Presiding Officer, as a matter of priority, one of the things I was told when I became Cabinet Secretary was that the National Health Service was very good at testing, but not so good at spreading. And I'm absolutely determined that we become as good at spreading good practice as we are at testing and piloting good practice, and prescribing and improved prescribing and the cost effectiveness of prescribing is exactly one of those areas where, on the basis of the tremendous performance by Glasgow, we intend to roll that out across the entire country.
Question number 7, Kenneth Gibson.
What progress is being made with the Cumbria Public Reference Group on reviewing and improving health services on the island?
Minister.
Presiding Officer, throughout the review to improve health services in Cumbria, there has been comprehensive engagement with people on Cumbria, including the Cumbria Public Reference Group. The Scottish Government continues to take a keen interest in the progress of these discussions. Ayrshire and Arden Health Board assumed responsibility for providing out-of-hours cover since February 2012. From April 2013, new interim arrangements will be in place to maintain both an hours and out-of-hours GP cover on Cumbria until such time as a new model of working that fully meets the requirements of the people of Cumbria can be fully introduced.
Kenneth Gibson.
I thank the Cabinet Secretary for his answer. Cumbria is a particularly vulnerable community, with more than 30% of its 1,350 or so residents being 75 or older. Can I confirm that the position of Ayrshire and Arden Health Board is to improve and enhance Cumbria's health services, not least by, if possible, securing a new GP practice on the island?
Cabinet Secretary.
Officer, I can confirm that the Cumbria GP practice vacancy has been advertised with the closing date for applications of the 8th of March 2013, following which the Board will apply its normal process to appoint a new GP contractor. In the meantime, from the 5th of April, when the current GPs retire, the Board will run the practice directly using locum GPs who have already been secured, and will continue to do so until such time as a new contractor is appointed. I want to stress that the NHS Ayrshire and Arden Board see this review as an opportunity to ensure safe, sustainable, high-quality and cost-effective services are provided for Cumbria, and continues to progress the review in an open, inclusive way with all stakeholders, in particular the Public Reference Group, who represent the people of Cumbria.
Question number 8, Jamie Hepburn.
To ask the Scottish Government what steps it is taking to encourage healthy eating in Cumbernauld and Kilsyth.
Minister.
Last month, our Scottish Cooking Bus visited St Patrick's Primary School in Kilsyth, where local children and parents enjoyed healthy cooking sessions. And last week I saw the cooking bus in action at Mertland School in nearby Kirkintilloch. The bus is just one part of a suite of actions to improve diet. We are spending some £7.5 million over 3 years to encourage healthy eating, and we are also discussing actively with the food industry what more they can do to help to promote healthy eating.
Jamie Hepburn.
I thank the Minister for that answer, and also welcoming the activity that took place at St Patrick's Primary School. That is recognition, of course, that one of the ways to encourage healthy eating is to engage with young people at an early stage. In that regard, would the Minister join with me in congratulating the staff and pupils of Avonhill Primary School who need some cheer today because the council was decided to close their local high school? Would join me in congratulating them on their success in earning the Healthy Eating Initiative Award 2012.
Minister.
The member makes a very important point, because it is important that we do support young people in making healthy choices, because we know that if we can help to educate their palate at an early stage in eating healthy foods, that's likely to continue with them as they develop. Aben Hill Primary School are clearly on the front foot in this respect, and I would of course join the constituency member in offering my congratulations to the pupils and the teachers on winning the Healthy Eating Initiative Award 2012, and I wish them well with their ongoing work in this area.
Question number 9, John Pentland.
Thank you, Presiding Officer. To ask the Scottish Government when the Cabinet Secretary for Health and Wellbeing last spoke to the Chief Executive of NHS Lanarkshire.
Cabinet Secretary.
Presiding Officer, Ministers, including myself and Scottish Government officials, regularly meet senior management from NHS boards, including NHS Lanarkshire.
John Pentland.
Can I thank the Cabinet Secretary for that reply? I was wondering whether the letters from Lanarkshire Links were discussed, asking about the 7-month delay in implementing the mental health plan for North Lanarkshire, endorsed by Nicola Sturgeon. If you, Cabinet Secretary, are not the cause of that delay, why are we still waiting for this plan to go to the board?
Cabinet Secretary.
The Presiding Officer, as I have made clear in this chamber many times, responsibility for any ministerial decisions and discussions on this matter rests with my colleague Michael Matheson, because I have taken myself out of that discussion in line with to ensure that there is no potential or actual conflict of interest between my role as the MSP for Airdrie and Shotts and the surrounding villages and the Cabinet Secretary for Health and Wellbeing.
Claire Adamson.
Thank you, Presiding Officer. Can I ask the Cabinet Secretary to let Parliament know that when he last spoke to the Chief Executive of NHS Lanarkshire, whether he discussed progress towards single-room provision in hospitals in Lanarkshire?
Cabinet Secretary.
Presiding Officer, when I met with the Chief Executive of NHS Lanarkshire, a range of issues were discussed. My officials are working with colleagues in NHS boards to support them in the implementation of Scottish Government policies, including increasing the provision of single-room inpatient accommodation.
Question number 10, Linda Fabiani.
To ask the Scottish Government what recent progress Healthcare Improvement Scotland has made in inspections of care for elderly people.
Cabinet Secretary.
Sorry, Linda.
Question number 10.
Sorry, I've got my notes wrong here. My apologies. Healthcare Improvement Scotland has inspected care of older people in 12 of the 23 acute general hospitals in the inspection programme across 7 NHS boards. The inspections have highlighted areas of current good practice and areas where improvements must be made. Following inspection, boards have developed action plans to address all areas for improvement, and Healthcare Improvement Scotland is closely monitoring boards' progress in implementing agreed improvement measures. This is exactly why we asked for these inspections to be carried out, and reassures me that the inspections are driving up the standards of care for older people in hospitals right across Scotland.
Linda Fabiani.
I thank the Cabinet Secretary for that answer, but does he agree with me that an important part of care for the elderly is ensuring dignity? And could he consider how this is measured during inspections, and should hospitals be encouraged to implement robust procedures of encouraging and paying heed to feedback from users and their families and friends?
Cabinet Secretary.
Absolutely. There should be feedback to carers, to family, to friends, as well as to the patients themselves. And Healthcare Improvement Scotland have made that absolutely clear. And indeed, if there are any urgent issues during these inspections, they are reported immediately to the appropriate member of the senior management team within the hospital for immediate action. In terms of dignity, a whole list of action items are taking place to improve the dignity of people in hospital. For example, yesterday I had the pleasure of opening the new Royal Victoria building as part of the Western General in Edinburgh, and in the 5 wards with 26 rooms, each with 26 rooms, in every case these are single-room units with their patients having their own toilet, en-suite facilities, and from speaking to the patients, they advised me, even the ones who were sceptical about the benefits of single rooms before they went into single rooms, that they are of huge benefit. They are real converts, and one of the main advantages of a single room is that you're not wakened during the night by other people snoring.
I wouldn't know. Jenny Mara.
Presiding Officer, in reference to the September inspection of Ninewells Hospital Elderly Assessment Unit, can he tell me why Healthcare Improvement Scotland decided not to publish the inspection after they had received the factual inaccuracies from NHS Tayside, which is the appropriate mechanism? So why they didn't publish the report, and why 2 inspectors have resigned over the failure to publish?
Cabinet Secretary.
Well, first of all, on the latter point, my understanding is that the reason for the inspector's resignation was not to do with this particular inspection. Secondly, in terms of the decision not to publish at that particular time, as Healthcare Improvement Scotland have explained publicly, that was because they did not believe that the process had met their very robust quality assurance standards, which is why they had a second unannounced inspection, the results of which were published last week. I also believe that Ms Mara, in an interview last week, has changed her mind from accusing the Health Board of a whitewash and now admits that no whitewash took place.
Question number 11, Alex Ferguson.
Thank you, Presiding Officer. Could I ask the Scottish Government what measures are being taken to improve access to GP services?
Cabinet Secretary.
Presiding Officer, the Scottish Government has invested approximately £12 million during 2012 to encourage GP practices to improve access for patients. We've introduced an enhanced service arrangement to extend opening hours beyond core hours, offering patients early morning and evening appointments. The Scottish Government has also successfully reached a negotiated settlement with GPs for next year. The measures will mean that more patients in Scotland will benefit from evidence-based care, including blood pressure control, cholesterol and flu immunisation, helping to reduce the risk of complications and admissions to hospitals. As part of this agreement, we have the commitment from the Scottish General Practitioners Committee to work with the Scottish Government to review access arrangements.
Alex Ferguson.
I'm grateful for that response, but I'm sure the Cabinet Secretary is aware that the number of GP practices has continued to decrease since 2007 and has now fallen below 1,000 in Scotland for the first time. Many GP surgeries don't actually have a website, and I'm sure the Cabinet Secretary is also aware that there are moves in other parts of the United Kingdom to ensure that patients will be able to arrange such things as repeat prescriptions, the booking of appointments and obtaining test results online by 2015. May I therefore ask what steps the Scottish Government is taking to encourage Scottish GP practices to expand this type of activity, particularly in rural areas where I think it would be very helpful?
Cabinet Secretary.
Presiding Officer, the member raises a very valid point. Our view is that, for example, online repeat prescriptions should be available from every GP practice within a reasonable time period. It seems in 2013 that is a basic requirement, and we're working with GPs across the country and with health boards to make sure that that kind of service is available. We're also working with the GPs and with the BMA Committee of GPs to look further beyond, not just this year, but further beyond that, to look at how we can reduce some of what they would describe as the red tape requirements on them as part of the contract to free them up to spend more time in providing direct services to their patients. And, of course, the member will be glad that in Scotland, unlike south of the border, we negotiated an agreement with the GPs. We are not imposing an agreement against the will of the GPs, as they are down south, led by his colleagues in the Conservative Party.
Jackie Bailey.
The Cabinet Secretary will be aware that there are far too GPs operating in deprived areas, and access as a consequence for perhaps some of the most needy patients is constrained. Will he agree that it would be useful for the Government to collect current data on GP numbers and their distribution, because the last data set is apparently 10 years old? And what action will he take to ensure that there are extra GPs and additional capacity available in deprived areas?
Cabinet Secretary.
Presiding Officer, I'm very keen to look at how we can extend particularly the role of DPEN practices which service deprived and poorer areas. We do now, I think, have over 100 DPEN practices in Scotland, many of them concentrated in the Greater Glasgow area, but very clearly they have been very successful. And I'm proactively looking at how we can improve the number as well as the range of services provided by DPEN practices in the poor and deprived parts of Scotland.
Aileen MacLeod.
Thank you, Presiding Officer. The Cabinet Secretary will be aware that in England, many local GP services are being contracted out to private providers such as Virgin Healthcare or Serco, and that there are accusations this has led to poorer access to services. Will the Cabinet Secretary confirm that NHS services will remain in public hands in Scotland?
Cabinet Secretary.
Presiding officer, I remember some time ago when Andy Kerr, that long-forgotten name, was the Minister of Health and tried to privatise GP services in Hart Hill, which is now part of my constituency. And we put an end in Hart Hill to Labour's privatisation agenda, and will certainly not be following the Tory Liberal Democrat privatisation agenda north of the border.
Question number 12, Liz Smith.
To ask the Scottish Government what air ambulance provision there is across Scotland.
Cabinet Secretary.
Presiding officer, the Scottish Ambulance Service currently operates the only integrated publicly funded air ambulance service in the UK. It flew 3,382 missions in 2011-12. Under the current arrangements, cover is provided by two purpose-built fixed-wing King aircraft based in Aberdeen and Glasgow, and two EC-135 helicopters also built as dedicated air ambulances based in Inverness and Glasgow. These aircraft are backed up by MOD Coast Guard aircraft in the case of time-critical emergency evacuations, where the weather conditions prevent the deployment of the contracted aircraft. In June 2012, and following an extensive re-procurement process, the Scottish Ambulance Service announced that the current service providers, Gamma Aviation and Bond, have been awarded a new 7-year, £120 million contract, which will commence from 1st of April this year. In addition to sustaining the current levels of provision across Scotland over the coming years, the new contract includes a new generation of the EC helicopter, the EC-145, and these new helicopters will be introduced during 2014. The greater capacity, speed and range of these helicopters will enhance the service currently provided.
Liz Smith.
Thank you, Cabinet Secretary. I'm impressed with your technical knowledge there. I'm sure you would want to also welcome the new Scotland's Air Charity Ambulance, which has taken the place in terms of Perth Airport in serving to increase the number of daylight hours. It's boosted that service by 50%. Is it the Government's intention to be able to measure just how much extra additional service we require to ensure that all rural areas are fully covered?
Yeah, absolutely. It's a situation we're keeping very closely under review, and indeed I've had discussions with some of our parliamentary colleagues covering the Northern Isles, for example, to ensure that the coverage is improved in terms of, particularly during periods of bad weather. But also the additional capacity provided by this new service is very, very welcome indeed. And indeed, before I come into the chamber, I actually had a meeting with one of the major funders of the new service and congratulated and thanked him and his colleagues for the tremendous generosity they have shown, because this will make a very significant improvement in air ambulance cover for many parts of mainland Scotland, but also particularly for the islands of Scotland.
Before we move to the next question, I want to make progress through the remaining questions, so I'd be very grateful for short questions and answers. Question number 13, Bill Kidd.
Thank you, Presiding Officer. To ask the Scottish Government what lessons have been learned from Glasgow's Equally Well testing programme.
Minister.
The Equally Well test site programme set out to support new ways of working in community planning partnerships, to do things differently and to do different things. Several key factors have been associated with local success across all the test sites, including those in Glasgow. These are the need for a skilled coordinator, clear shared outcomes, empowerment of staff, space for reflection and learning, and a senior level of commitment and leadership. Evaluation has suggested that the more these building blocks are taken forward as part of the partnership redesign, and which are enthusiastically and consistently pursued, then there is more success from the projects that come from this. The reconvened Ministerial Task Force on Health Inequalities, which I chair, is already scheduled to examine the lessons learned and outcomes derived from the test sites at its next meeting.
Bill Kidd.
Thank the Minister for that reply. Can I further ask what plans the Scottish Government has to implement those lessons, specifically regarding integration of health issues into city planning Scotland-wide?
Minister.
The Scottish Government is currently reviewing the National Planning Framework and the Scottish Planning Policy. we are considering how best to reflect these lessons from Equally Well and also from Good Places, Better Health into these particular policy documents, and we aim to publish both of these documents for consultation around the end of March this year.
Question number 14, Duncan McNeill.
To ask the Scottish Government when the Cabinet Secretary last met the Chief Executive of NHS Greater Glasgow and Clyde and what was discussed.
Cabinet Secretary.
Presiding Officer, both ministers and government officials regularly meet with NHS boards, including NHS Greater Glasgow and Clyde, and a range of matters of importance to local people are discussed.
I thank the Minister for that response. Sudden death of a loved one can be a traumatic experience for any family, and for most cases this will result in a post-mortem. In the west of Scotland, that procedure would likely be carried out at the Southern General Hospital in Glasgow. The current wait, Minister, for that post-mortem will be 10 days, and in some local circumstances this is stretched to over 2 weeks, increasing the trauma for that family, disrupting religious and cultural practice and making the bereavement process even more difficult. Will the Minister instruct his officials to bring together Glasgow and Clyde Health Board and the Scottish Fatalities Investigation Unit to ensure an investigation into this unacceptable situation for bereaved families?
Cabinet Secretary.
Presiding Officer, can I first of all thank Duncan McNeill for the way in which he's raised this issue, because it's a very sensitive issue and it's important that post-mortem should be carried out as quickly as possible to minimise any upset and distress to bereaved families. I've been assured by NHS Greater Glasgow and Clyde that there are no delays to the NHS service. Fiscal post-mortems are the responsibility of the Crown Office, although I will refer this question and answer to the Lord Advocate to bring this matter to his attention. I understand that within the board area there are less than 100 hospital post-mortems carried out annually. Pathology services are scheduled on a Tuesday and a Thursday each week at the Southern General site for this activity. At a family's request, however, to meet personal arrangements, for example a set day for a funeral, the post-mortem will be rescheduled to meet this need, and as I've already stated, I'm not aware of any delays from the hospital-based post-mortems in the Greater Glasgow and Clyde area. I do recognise the point that Duncan McNeill makes, and I will refer this matter to the Lord Advocate.
Question number 15, Rhoda Grant.
To ask the Scottish Government what action it is taking to ensure that patients requiring radiotherapy after surgery receive it as soon as possible.
Cabinet Secretary.
Presiding Officer, cancer treatments that are subsequent to the initial cancer control treatment are in general covered by good practice clinical guidelines rather than management targets, allowing clinicians to prioritise and make decisions based on clinical need and best practice. These guidelines and recommendations are based on clinical evidence to deliver the best outcomes for patients, not upon arbitrary timelines. Over the last 3 years, the Scottish Cancer Task Force has made over £3 million available to facilitate the introduction of new technologies and drive forward improvement to meet the ambitions of the quality strategy, including access to radiotherapy.
Rhoda Grant.
Cabinet Secretary will be aware of the report in the Press and Journal today that said that NHS Highland currently has around half of its medical physicist posts vacant. What steps is he taking to attract, retain and indeed train medical physicists to ensure that treatment can be delivered at the optimum time, and what thoughts has he given to including this in the treatment waiting time guarantee?
Cabinet Secretary.
Presiding Officer, we are doing everything we possibly can to recruit people in rural areas. Can I say there is, not just in Scotland but across the entire UK, a particular problem in the recruitment and retention of particularly doctors, consultants and GPs in rural and remote rural areas and in island areas. And it's an area I'm concentrating on to look at how we can do more to incentivise people to come and work, professionals to come and work in rural areas. I visited the Ardnamurchan Peninsula last week and witnessed there the proposals to establish a completely new way of delivering GP services on the peninsula, which instead of having 3 small GP practices will incorporate all those GP practices into one larger practice, and we believe that that's one of the ways in which we can recruit and retain GPs in rural areas. We do also have a problem in filling consultancy posts. For example, most recently we were able to fill a consultancy post in the Western Isles, which had been vacant for just over a year. The upside of that is that it was filled. The downside is it was filled from somebody from another remote rural area hospital. So in terms of the net contribution to solving this shortage in rural areas, it was fairly neutral. But Rhoda Grant does raise a valid issue. There is a genuine problem in recruiting consultants and GPs in rural areas, and it's one that we're very conscious of and taking a lot of proactive action to deal with, Presiding Officer, and I apologise for the length of my reply.
I should hope so too, Cabinet Secretary. Can I apologise, not on behalf of the Cabinet Secretary, but can I apologise to members for the external noise from the building work? The contractors are well aware that when we sit in the chamber that there should be no work, and message has gone out to them now to cease and desist. We now move to the next item of business on motion number 5550 in the name of John Swinney on the budget.